thank you, Bob, for that introduction, and thank you all for being here, also for caring, and more importantly, I want to thank you in advance for not just simply coming here and listening, but coming here and committing to be someone who helps make a difference. I've given talks about this issue for almost 10 years now. I came to Children's Hospital in 1991, and Paul, I'm going to ask you to time me. Can you hear me in the back? No. Okay, BFG, the same business. So I'm a pediatric surgeon at Cincinnati Children's Hospital. I'm proud to say that it's the #1 in my mind, but #3 nationally, okay, as far as the best children's hospital. I was asked to develop here a trauma program. As a trauma surgeon, I'm responsible for taking care of children who are seriously injured. And the reason they asked us to develop this trauma program is that injury is the leading cause of death for children, okay, in the United States. More children die as a result of injuries than cancer, infectious diseases, you name it. More children die as a result of injury than any other disease or combination of disease. During my time here in Cincinnati, I have seen the profile of children as victims of injury change dramatically. And I made a commitment to a mother whose child died as a result of a gunshot wound to the chest, died despite the efforts of the #1 children's hospital, #1 trauma center, okay, because of a gunshot wound to the chest. She was 12 years old. The average age of a child that comes into Children's Hospital with a gunshot wound is 12.9. During my time as the active trauma director, I saw a 300% increase in the number of children coming in with gunshot wounds. My message here succinctly is this: violence in our community is a social disease that is preventable. When we hear about the violence, our tendency is to be judgmental. I wouldn't have done that. Okay? You wouldn't have done that. I would suggest, though, that if we look at this from a systems perspective, you will see that not only is violence a disease, okay, and when we label it as a disease, we need to think differently about it. Not incarcerating people to the extent that it compromises what we can and should spend on education and health care, but to understand what the root causes are of violence. So here quickly, in the 10 minutes, I'm going to skip through, and here's my journey. You're beginning on a learning journey here. You've come here to understand something. The Archbishop has given us a decree. We have to do something. But we have to understand better what it is and why we have this situation and what are the consequences of it. This little diagram here would suggest to me, would suggest to you as it did to me, that it's just ask the question, why is it that we have this spatial clustering? What I mean by clustering, when you look at a diagram of where the homicides, where the infant mortalities are, where's obesity, where's asthma, it's all clustered in certain communities that have one thing discreetly in common, and that is concentrated poverty, concentrated disadvantage. Okay? So we're here to talk about recidivism. I'm going to close the loop here about this. Okay? This is Cincinnati. We have the same situation here. There's certain communities. You can't see it in the back, but believe me, I'm a doctor. All right. So what we now know, okay, as a doctor, okay, you would think it foolish if you came in as a, let's say, a smoker, coughing, and I didn't bother to get a chest X-ray, and instead all I did was give you what? Some cough syrup, and said you're going to be fine. Because if I knew that you were a cougher for what, a smoker for 27 years, I would want to do what? I want to get a chest X-ray to see if I have a lump there or not, right? So this is the same approach we've taken here as far as this is concerned. We know, the science is there, the evidence is there, that this is a social disease that needs to take a social, requires a social solution. But not only is it violence, okay, but it's also as a consequence of the prison sanctions that Bob just shared with you. One of the phenomena is that we don't spend as much money on education, and particularly in those communities that are most impoverished. Well, you know that if a child is not reading at grade level by the time they enter the 3rd or 4th grade, there are people who are building prisons based on that data because they know that they're going to be, those folks are not going to graduate from high school and then they're going to not get a job and they're going to get into prison. There are people who actually plan on the prisons based on reading levels. So, as a consequence of the incarceration, we have then people who are not reading. Okay? But did you know that as a result of the concentrated disadvantage in these communities, that not only is there issues with reading, but there are also issues with brain development. We now know that children who are in these concentrated distressed areas have elevations in cortisols and adrenaline and epinephrine that it affects parts of the brain that are important for memory, okay, and reading ability. Okay, so that's number 2, right? Number 2. So we have violence as a social disease, we have reading. What about, let's say, asthma? In those communities of impoverishment, okay, one of the leading causes of asthma is what? Roaches. Roaches. Right. Okay. So we check off asthma. What else? Obesity. Obesity turns out to be perhaps the most expensive epidemic in this country. At this rate, we are predicting that 1 out of every 3 children will develop diabetes, principally because of obesity. Obesity is the leading cause of acquired blindness, kidney failure, and amputation. So much time, go ahead, Paul. 4? All right, I'll talk faster. So now we have obesity, and what else did I say? Diabetes. Okay. We also know that in these communities then, okay, that have this chronic poverty issue, okay, that your chances of developing a chronic disease is increased 30-fold. 30-fold. As a matter of fact, the sociologists have defined this as excess deaths. The number of excess deaths in communities that have violence and this clustering of diseases is the equivalent of a 747 crashing every year, every month, or every day. Every day. Excess deaths. People who are dying. Martin Luther King said that the greatest injustice, okay, is inequality. But the most inhumane is the injustice of unequal health outcomes. Children in these communities in the United States, we have the highest infant mortality rate in Cincinnati. Cuba has a better survival rate. Right? I submit that that's because of this concentrated poverty. Now, how does that link back then to this discussion? Well, if you are in prison as a felony record, and we're not here to debate about whether it's fair that African Americans are disproportionately in prison. But if you are in prison, the research shows that your chances of getting a job are A, less than 30%, B, less than 15%, C, less than 7%, or D, less than 5%. Less than 5%. Less than 5%. Let me say that again. Your chances of getting a job, okay, less than 5%, even though you paid your dues. But if you don't get a job, then you're back into prison, 45% within 1 year, 2/3 within 3 years. Because you got to do what you got to do. It's easy for us to say, well, I wouldn't sell drugs. But when I asked some of the people when I was running SERV, what did my message say about stop the shooting? And they took me out. He said, well, look, Doc, look up there. You see that apartment, that apartment, that apartment, that apartment? That's where my mother, that's where my grandmother, that's where I live, and that's where my aunt lives. You tell me to stop dealing drugs with all that's associated with that? Are you going to help me right now to pay for all that? And I became very quiet. Okay. So that's the real world. It developed empathy for them. Not that I approve of what they're doing, but I understand. And for the grace of God, I would be in that position, given the color of my skin. And perhaps some of us would be in that same position. So let me wrap this up in the last 1 minute. Okay. And that is that poverty, because of being contributed to by the fact that we are not giving young men and women a second chance, is reinforced. That poverty, remember the saying, the child is father of the man? That poverty affects not only the young men, some of whom are here, but also their children. Their children. And I'm a pediatric surgeon. I said the Hippocratic Oath to prevent, to save, and improve lives. What we're seeing today, what we're doing today as a society, is unconscionable. I can't sleep at night. Neither should you until we address this in our lifetime. Prayer is good, but we got to get on our feet and be part of the solution. Thank you very much.